Fistula is an abnormal opening, usually between the bladder and the vagina, but sometimes between the rectum and the vagina as well. And most commonly it's due to obstructed labour, where the head pushes against the soft tissue of the birth canal and a hole is formed. And that means that a woman will be incontinent of urine and sometimes of faeces as well. If you have a fistula, life can be absolutely appalling because you're leaking urine or faeces all the time, you smell, people avoid you, they ostracise you, you're stigmatised. So on top of the isolation and the rejection they experience, they've also lost their baby because the vast majority of labours that are obstructed and cause fistula, the baby is stillborn.
But I pushed for long, about 9 hours. Push, the nurse was telling me, push, and I pushed for very long. So after that, the urine started dropping. Then the doctor checked me and told me, you have a problem of that fistula. And he told me that go to Chitovu, they will help you.
What fellows and members can do is get involved in training programs, so teaching about emergency obstetric care, about recognising and preventing obstructed labour, and then operative delivery when necessary. Beyond that, it may be that members and fellows have special expertise in vaginal surgery and they can be part of fistula camps and part of training programs and fellowships to teach fistula surgery.
Over the last 7 years I've been going to Kitovu, which is in Uganda, and I've been volunteering to help trained surgeons in Uganda to be able to look after their own communities. And I've been teaching them how to repair fistula.
We had 3 patients, and then the 2 of them I had to advise them to come for the following camp. And they said, now, you know, sister, we have come from far, now you are sending us back, we thought we are going to be operated now. There are those whom I can treat conservatively, like those who have pinhole, I put in a catheter and they come back when they have improved. They are dry. Others have sort of a stress incontinence, so I train them on how to do exercise and then continue with the bladder drainage, all those things. Health educate them, advise them on the feeding and all those things, encourage them, counsel them. So at least, even if they don't get the operation, at least they have benefited psychologically. What we had in mind is to get a permanent surgeon. These mothers should not go back home. We can continue working on them, and also as we are improving on our skills, again we help these mothers not to get stressed up with this condition.
From the hospital, telling me that I have to go to Chitovu and operating me, I waited for about 2 months. It could be better when we had our Uganda doctors to operate us with that fistula, because we could find no problem. They could operate us very early, not to wait for so long with that problem, waiting for the doctors from outside the country.
The work that's going on in places like this is fantastic because they're treating huge numbers of women and really totally changing their lives. But what would be even more fantastic is if this service was a permanent one, so we had trained enough people to be able to keep this service running 12 months of a year instead of the wards lying empty in between different camps.